Hey everyone, my name's Amanda Hartzell and I'm a speech language pathologist at a skilled nursing facility. This month we are celebrating Dysphagia Awareness Month. So, a little bit about me. I graduated from the University of Florida and received my bachelor's in communication sciences and disorders with a minor in disabilities in society. And also, I received my master's in speech language pathology. Currently, I work at a skilled nursing facility, and I've been there a little over a year. My fiance is a physical medicine and rehabilitation resident physician, and some of our hobbies include salsa dancing, working out, studying at coffee shops, and traveling. So, like I said, June is National Dysphagia Awareness Month. Ever since there was the statute that was passed by Congress in 2008. So, what is dysphagia? Dysphagia basically means swallowing difficulty. We'll get more into that later. But an interesting fact is that adults swallow approximately 600 times per day. And if you think about that, that's 1 to 2 liters of saliva you're swallowing per day. Who can be affected by dysphagia? Really, the answer is anyone. It can happen as a result of any of these categories listed below, for example, stroke, Parkinson's disease, dementia. Those are just some examples. Where might dysphagia occur? So, yes, it is a swallowing disorder, but there's 3 stages of swallowing. The first is the oral phase. So some different deficits that might occur in the oral phase is maybe you need some extra time to chew. Maybe you're wearing dentures or not wearing dentures. Food falling out of the mouth when you're chewing because maybe from a stroke. Maybe you can't feel the food falling out because you have a facial droop on the right side. Another example is oral holding, holding the food in your mouth and not initiating a swallow, or pocketing the food because, again, maybe from a stroke you can't feel it. Also, there's the pharyngeal phase. So, some examples of this include maybe needing extra effort or time needed to swallow, coughing or choking during or after the swallow. And this poses an overt sign of aspiration, so liquid or food going down the wrong way into the airway. Having a wet, gurgly voice during or after the swallow. Having recurring pneumonia or chest congestion after eating, or having a globus sensation. So basically, you feel food stuck in your throat. And then last but not least is esophageal. So maybe someone has GERD or recurrent heartburn, or they're regurgitating a lot. So these are just different examples within the 3 stages of swallowing. An SLP should treat dysphagia because dysphagia can pose certain complications. For example, it can cause aspiration pneumonia, which is a type of lung infection that's due to a relatively large amount of material that enters the lungs. It can cause malnutrition or weight loss, dehydration, isolation, and depression from not wanting to go out to eat with others because they're afraid they might cough in front of them multiple times, choking, and low self-esteem. So, how does an SLP treat dysphagia? So, first, we like to start off with a clinical assessment. This can include a clinical swallow examination, looking at a patient swallowing from bedside. We can also include an oral mechanism examination to look at one's cranial nerves. We can do a functional oral intake scale of what their current diet is, ask them a series of 10 questions called the eating assessment tool, which has the patient indicate if they perceive a swallow impairment themselves. And also, we can test their cough strength by using a peak cough flow meter. We can also do a modified barium swallow study or a fiber optic endoscopic examination of swallowing to more objectively assess their swallow anatomy and physiology. Some other things speech pathologists can do is diet modification. So they can be NPO, which means nothing by mouth. Sometimes they'll have a G tube or an NG tube. We can put them on either a puree, mechanical soft, or regular diet. As far as liquids, we can do honey thick liquids, nectar thick liquids, or thin liquids. We can do certain positioning or compensatory strategies. So sitting upright with all meals, alternating bite sips, having a slow rate of intake with small bite sips, completing oral care 2 to 3 times per day. Simple things like that, doing an effortful swallow, doing a chin tuck. Those are different things. And then specific treatments or exercises, we have Omni SEMG virtual reality assisted therapy. So we use this at the skilled nursing facility that I'm at, and basically it enables us as SLPs and patients to visualize swallow activity. It creates visual and auditory feedback. So it's definitely something that's really cool. We can also do pattern electrical neuromuscular stimulation, and this can enhance the neuromuscular control required for normal swallow function. It can address muscle disuse atrophy associated with dysphagia. Something else is the Fraser-free water protocol. So this is basically allowing someone to have ice chips or water between meals after good oral care. We can do tongue strengthening using what's called the IOP, or we can do expiratory muscle strength training or EMST, and that can help with swallowing as well as respiratory. Thank you so much for watching my PowerPoint video. Please remember to like, comment, and subscribe, and I'll see you at our next video. Thank you.